Today we have recorded 127 positives from a test pool of 2,247 samples. This now brings the total of confirmed positive cases to 2,989 from 100,683 samples tested so far. And the cumulative number of recoveries to 873. We would have wished to be discharging more patients than admitting. This, however, is not the case just for today, because we have discharged 24 people who have recovered from the disease over the last 24 hours. And as I said earlier, this brings the total number of discharges to 873. Today's cases are 124 of these cases are Kenyans and 3 are foreigners who live amongst us, with 84 being males and 33 females. The youngest is a 3-week-old infant, and the oldest is 72 years of age. The distribution of cases in the counties is as follows. Nairobi has 62, Mombasa 34, Busia 14, Machakos 4, Bungoma 3, Kwale and Uasin Gishu 1 each. If we go down to the sub-counties in these areas, Nairobi, the cases are from Kibra 21, Westlands 14, Ruaraka 12, Kamkunji 5, Langata 4, Dagoretti North 3, Makadara, Embakasi South, and Embakasi West 1 case each. In Mombasa, the cases are from Mvita 8, Nyali 7, Changamwe 6, Jomvu 6, Kisauni 4, and Likoni 3 cases. In Busia, all the 14 cases are truck drivers at the Malaba port of entry. In Kiambu, the cases are from Thika 2, Ruiru and Kikuyu 1 each. In Kilifi, the 4 cases are from Kilifi North 2, Kilifi South, and Kaloleni 1 case each. In Machakos, all the 4 cases are from Athi River. In Bungoma, all the 3 cases are of truck drivers from Kandui, while the 1 case in Kwale is from Matuga, and the case in Uasin Gishu is from Keses. Sadly, we have lost another 3 more patients to the disease, bringing the tally of fatalities to 88. I send my heartfelt, deepest condolences to the family of the departed. Yesterday, I informed you about healthcare workers and the risk they stand being in front line of contracting various infections, including COVID-19, as they discharge their duties. As pertains to this current COVID-19 pandemic, 72 frontline healthcare workers have contracted the virus from different environments. Out of these, 19 are currently being managed in different health facilities. The risk of infection has, however, not undermined their commitment to duty. I therefore want to take this opportunity to thank them for their dedication and devotion to serve Kenyans even in the face of being infected. In conclusion, I want to remind ourselves of our resilience as a people. This situation has made us overcome several adversities in the past, and I am confident that together, as we stay the course, we shall overcome.
The National Task Force has given guidance to counties to identify and equip quarantine and isolation facilities in each county. And there has been a team that has been going out to assess and ascertain the status of these isolation and quarantine facilities in terms of standard of was based on the requirements as provided for isolation and quarantine facilities. And it did confirm that a number of them, of course, may not have met the standards, and they have revised this. And we can confidently confirm here that, so to date, we have more than 101 quarantine facilities across the country, and at least 50 isolation facilities across the country, with a total bed capacity of over 3,700 beds. This is what guided the directive given on Saturday, that we need to scale up this bed capacity, considering the modeling data that is now available, that projects that the number of cases requiring hospitalization and ICU care is going to surge in the coming few weeks. And no wonder then that even the restrictions were put in place to try and limit this surge, or at least delay it and prepare and give time for counties to prepare themselves for this surge. So there is adequate capacity, and going by the numbers of patients who are in hospital today, you can obviously say that indeed there is still capacity across the country. But you may have learned that a number of them, Nairobi and Mombasa, we already have been starting to feel the effect of the increasing numbers of these cases.
Siaya, which has a 10-bed capacity for some of the people who get infected.
The same WHO has also mentioned that elderly and the most vulnerable, coming to our local scenario here, most of the patients
Is the situation in Kibra out of control?